How does acetic acid help during a cervical colposcopy? Have you ever wondered how doctors can spot potential issues during a cervical colposcopy? One key player in this process is acetic acid. Typically used at a concentration of 3 to 5%, acetic acid is applied to the cervix to enhance the visualization of abnormal tissue. When acetic acid touches the cervix, it triggers a chemical reaction known as acetohydroning. This reaction causes abnormal areas, such as cervical intraepithelial neoplasia or precancerous lesions, to turn white. This stark contrast against the normal pink tissue makes it easier for clinicians to identify areas that may need further examination or biopsy. So, what's happening at the cellular level? Acetic acid causes reversible coagulation or precipitation of nuclear proteins and cytokratins found within the epithelial cells. Abnormal or precancerous cells contain a higher concentration of these proteins, leading them to coagulate more intensely. As a result, they appear white under the colposcope. In contrast, normal squamous epithelium has fewer nuclear proteins, so it shows little to no whitening. This difference is crucial for distinguishing between normal and abnormal tissue during the procedure. In practice, the application of acetic acid is straightforward. A healthcare provider uses a cotton swab, cotton ball, or spray to apply it after cleaning the cervix of any mucus or debris. The acetohydrolytic reaction typically appears within 1 to 2 minutes, with the most intense whitening occurring during this time. Colposcopists pay close attention to the intensity, extent, and duration of the whitening, as well as the vascular patterns present. Higher-grade lesions tend to turn dense white quickly and exhibit distinct vascular features, which aids in diagnosis. Using acetic acid is a standard and essential step in cervical cancer screening and early detection. It significantly improves the accuracy of identifying precancerous and cancerous lesions, guiding important decisions regarding biopsies and treatments. The concentration of acetic acid used can vary, but studies support that 3 to 5% is both effective and safe for optimal visualization. In summary, acetic acid plays a vital role during cervical colposcopy by highlighting abnormal cervical tissue through acetohydroning. This process facilitates the detection and assessment of precancerous and cancerous lesions, aligning with established medical guidelines for cervical cancer screening and early diagnosis. Always remember to consult with a healthcare professional for personalized medical advice regarding cervical health.